our first big story, and we've got to get to it, is a Wall Street Journal piece. It's a new piece that came out last night. Elon Musk has used illegal drugs, worrying leaders at Tesla and SpaceX. The article cites people close to Musk who say his drug use is ongoing. That includes board members, it feels like, and one name specifically, but it looks like they were all talking, particularly the ketamine, and there are concerns it could cause a health crisis or damage the business. Musk has a lot of business with the government, and he's already, I don't know if he was sanctioned, but he had to do drug tests after he smoked weed on Joe Rogan. This is seemingly more serious, and it's interesting that, this has been around. We've talked about it. Ronan Farrow wrote about it. Like, lots of people have cited this issue, not so much in Walter Isaacson's book, which it should have had more about it. But it's sort of an open secret about this, and the Wall Street Journal obviously has lawyered up to be able to say this. In a minute, we're going to bring on my brother, Jeff Swisher, to help us talk through this one. Just first reaction, Scott, and then I'll bring on Jeff.
First reactions. Look, we talk a lot about substances. The majority of people, I believe, who use substances manage them. And I'm not an anti-substance person, but along those same lines, there's just no free lunch. And when I saw Elon Musk in that interview at the Times Dealbook, I'm like, he's fucked up. Yeah. And there, it all comes back to one saying. What I tell young people around their use of substances is there's just no free lunch. What I have, and I'll stop here, but the thing that really struck me was when I was in Aspen this summer. I was alone and I was bored, and a friend said I have a bunch of friends there, and we all went to dinner, like 12 of us, bunch of total players in technology and private equity, and we went to this lounge, and I said, what can I get everyone? I'm headed to the bar. And they said, and this guy goes, they all kind of nodded or laughed and said, we're all on ketamine. And I thought, oh my God, everybody? This is like 6 men, right. 6 women, and the tech community likes to believe they have found a free lunch. And and we said this before.
So no repercussions, like
no such thing. There's no such thing. I haven't found it yet. Maybe caffeine. Caffeine's supposedly the closest thing to a free lunch, but I haven't found it. I'm sure. Yeah. I'm curious what Dr. Swisher thinks.
Yeah, we'll bring him on. It was interesting because this was the holiday season. This came out where he has some time off. I had heard rumors. There was rumors running around Silicon Valley that they had him in Hawaii last year. Same thing. And obviously, he's talked about it. Let's be clear. He's talked about his use of ketamine. He's talked about his mental health issues. Obviously, he smoked weed on Joe Rogan, and nothing wrong with that, except he has government contracts, which is a big problem. And I think away from his own health, which makes you worry, because there's been history of a lot of tech people like this getting into real trouble, like Tony Hsieh. I think it's been an ongoing discussion among and between people in Silicon Valley. And this one example in the piece was him being incomprehensible during a SpaceX meeting. And I think you're right. That interview, I looked at it and I thought, what? He's on something. I mean, I don't have any reported knowledge of it, but it really was such a bizarre interview. It seemed either mental health or something else was happening. Anyway, we're not experts, so we're bringing on my brother, Dr. Jeffrey Swisher, to help us talk through this one.
Hey, Kara, how you doing?
Good.
In the house. By the way, whose idea was it to bring
Swish.
on the good doctor? Whose idea was it?
You.
That's right.
It was not my idea. It was your idea, but it's a good idea.
Thank you, Scott. And it's good to see you when it's not Scott-free August, and it's fantastic. You look great.
Thanks, man.
Kara, I do have, unfortunately, one Scott joke for you. So, Scott, a Scotsman goes to the doctor's office, right? Okay. And he goes into the doctor and he lifts up his kilt and he says, "Doctor, I don't know. I think I'm going crazy." And the doctor says, "I don't know about crazy, but I can sure see your nuts."
Oh my God!
O is like Swisher. O is like
God.
D.
All right.
Yeah, Scott's.
Are you on ketamine, Jeff? Because that's what it sounds like. No, you're not a ketamine user. Explain.
No,
you use ketamine.
I do
in your
use
job.
ketamine. Let me talk to you a little bit about ketamine. So, ketamine is what's known as a dissociative anesthetic, and that's really important to understand. What it does. It dissociates you from essentially reality. It was first synthesized in 1962, the year you were born, Kara. And it was FDA approved in around 1970 for use in anesthesia. And I use it really pretty much on a daily basis. It's a very, very useful anesthetic. And in fact, the World Health Organization lists it as one of the invaluable drugs in the world. It's really good because it has a lot of beneficial effects from an anesthetic standpoint. It's not a respiratory depressant in usual doses. It's not a cardiac depressant. In fact, it slightly increases blood pressure and heart rate. And it doesn't blunt airway reflexes. So it can be used in a pre-hospital setting, let's say in the emergency room to sedate children. I use it as an adjunct anesthetic. I use it because it helps decrease the amount of opiates I use in the operating room. I use it for procedural sedation if I'm going to be doing something painful. Let's say a regional anesthetic block of the upper extremity. I will give somebody 30 or 40 milligrams of ketamine, and it allows them to actually participate, but essentially not be there. In the sense that
they feel calmer, right?
Actually, they do. They do. Depending on the person, they do sort of leave their body in a sense. In fact, some people describe a ketamine experience as similar to a near-death experience, where they can actually see themselves, let's say, floating above their body. The best description of ketamine from a patient that I ever had was. He told me afterwards, he says, imagine that you're driving a car toward a beautiful sunset and the Grateful Dead is playing on the radio and it's a fantastic, wonderful day with the breeze blowing through the window. Now for a second, imagine that you're not driving the car, but you are the car and you're driving. And all of a sudden, you're not driving the car, you're a passenger in the car. And that's really a really great description of ketamine. People describe a feeling of melting. You've heard the expression K-hole. People sort of fall into this kind of warm molasses pit when they're on it, and it's a very pleasant experience for most people. Not everybody. Some people do get frightening dreams, etc. on it, but for most part, it's a great anesthetic.
Have you
and
had
it's very
that
short
happen
acting.
with surgery where they get dreams or anything?
Oh yeah, all the time. I mean, people describe. One of the most common uses for it is. When I'm doing, let's say, a little old lady with a hip fracture, and it's very painful to put someone on their side to do a spinal anesthetic. So I'll give them 10 or 20 milligrams of ketamine, and they love it. I mean, they wake up afterwards and they say, that's the best experience I've ever had. So it's a very euphoric drug, and I can understand why people would use it for recreational purposes. Not that it's safe to do so.
But Jeff, talk about it in a recreational context, outside of the medical context, and that is, my understanding is, in contrast with alcohol or opiates, it's not physically addictive, but it can be psychologically addictive.
Yeah, and that's exactly right.
What we were saying before is that tech bros or the tech community or just successful people in general like to believe they found a better blueberry or a better solar panel. Like their tech, their diet is better. And I have found the same thing is true here, that people feel that ketamine is a safer high. Talk about it in the context of addiction and recreational use.
Sure. So, ketamine, it's widely available. It's very inexpensive to make, and therefore you can get it fairly easily on the street. It is a relatively safe drug in the sense that as opposed to methamphetamine, which can be really dangerous if you have cardiac issues, et cetera, or cocaine. The problem is that, like any recreational drug, people tend to binge it. They like the feeling of it, and then they need to start upping their doses of ketamine. And I mean, the really unfortunate situation that happened recently is Matthew Perry. And Matthew Perry was legitimately getting therapy with ketamine for depression, and we can talk about that if you want at some point. But the problem is he also was using it recreationally. And he also had other substances in his body on the coroner's report.
Yeah. So the piece quotes an attorney for Musk saying that he is, quote, regularly and randomly drug tested at SpaceX and has never failed a test. But we don't know. Can you talk about, and the attorney said there are other false facts in the Wall Street Journal, but didn't have any details. So this is Alex Spiro, who's sort of Musk's lawyer front man. But how do you think about drug testing on this kind of thing?
Well, there are ways of testing for ketamine. The metabolite, it's metabolized by the liver, and there are several metabolites of ketamine which are detectable. It's cleared by the liver, but it's excreted in urine and feces. So you can certainly test for it. The problem is it's a fairly short-acting medication, and it depends when you use it and what the levels are. Clearly, with Matthew Perry, for instance, they had it immediately because he wasn't metabolizing anymore after he died. But for people who are using it, you have to catch it fairly soon after they use it to detect it, which is one of the reasons, Scott, you mentioned that I think a lot of these tech bros and stuff are using it. But great caution, because dosing is very important. The other thing about ketamine I want to mention is that it can be given via a variety of routes. So you can inject it intravenously, you can subcutaneously inject it, you can intramuscularly inject it, you can snort it, you can swallow it, you can put it up your behind if you want. There's a lot of ways of taking ketamine, and so it's very bioavailable, let's put it that way. Intravenously, bioavailable, 100% intravenously, down to about 50% if you take it orally, or snorted, it's about 50 to 70%.
How do most people, when you give it, you do it intravenously because you're in an operating? How
I
do
it
most
both,
people recreationally use it?
When I give it intravenously and intramuscularly. It's a very useful drug. Let's say if you have a person with severe mental disorder who is combative prior to anesthesia, and I want to start an IV, I can give people intramuscular ketamine in that situation. And it takes a little bit, but then they'll sort of fall asleep. But usually I give it intravenously. But I'd say most people who are using it recreationally are probably snorting it.
Snorting it. Okay.
Yeah.
So let's talk about the Matthew Perry you were referencing. The coroner said he died from the acute effects of ketamine. He was on ketamine infusion therapy, as you noted. Talk a little bit about these therapies, because I'm about to interview Joe Green tomorrow. There's a lot of people trying very hard to replace opiates and other things with ketamine and other psychedelics. Is that problematic, or is just the abuse problematic?
I think it's the abuse that's problematic. I mean, ketamine for depression is an off-label use. I mean, and not that off-label uses are wrong. In fact, we every day doctors use medications in an off-label manner. It just means it's not FDA approved for that indication. They actually did make what's called an enantiomer of ketamine called S-ketamine, which is a nasal spray, which was approved by the FDA, I think, in 2019. It's called Spravato, and that was the indication for that is depression. And and as I said, it's a mirror isomer of ketamine. It's the same drug, but the mirror isomer of it. But ketamine clinics have popped up like kudzu, all over the place, and it's very, very expensive. I mean, thousands of dollars for a couple sessions of injecting. Now, keep in mind that the injection of ketamine in these clinics is a very small dose. It's typically a 0.5 milligram per kilogram, so usually 30 to 40 milligrams infused over about a 40-minute period. That's not a lot. It's not a lot to get you super high. A little dissociative, but not super high. When you're using it recreationally, who knows how much people are using? You can't really regulate your dosage.
Right. Now, one thing Elon tweeted about ketamine last June: depression is overdiagnosed in the U.S., but for some people it is really brain chemistry issue. He went on to say zombifying people with SSRIs for sure happens way too much from what I've seen with friends. Ketamine, some of my best friends use ketamine. Ketamine taken occasionally is a better option. How do you, when you hear him say that, I mean, a lot of people have problems with SSRIs.
SSRIs, yeah.
Yes, SSRIs.
Selective serotonin reuptake inhibitors is what that stands for. So ketamine is in the class of drugs that are called NMDA antagonists. And there's a lot of very useful work that's being done understanding NMDA antagonists in general for depression. And the research on it I wouldn't say it's definitive, but it's definitely statistically significant that ketamine definitely improves symptoms of both unipolar and bipolar depression in the short term. The question is it a lasting effect? That's hard to know, and I think that's ongoing research. And I personally, I think, Mr. Musk is correct in that sense. I mean, SSRIs are very different than ketamine. Still, though, ketamine is not a first-line therapy for depression. It's probably like a third-line therapy.
Right.
But a lot of people...
And they're trying to get it to be one for people with post-traumatic stress, etc.
Sure. Yeah, PTSD is a good indication for it. And, I personally know people who've had ketamine therapy who swear by it, who say that it's really improved them. So I do think that, shutting down any kind of research on this, that's why I don't really like that Matthew Perry article or even this Wall Street Journal article, because it demonizes a very useful drug. And ketamine is a very useful drug. Similar what happened with Michael Jackson and propofol. Every day people tell me, you're not going to give me that propofol drug. It's like, yeah, basically it's the most common anesthetic in the world. Yes, I'm going to give it to you.
By the way, it's amazing.
But, when...
It is.
Oh, it's amazing.
It's amazing. Whenever I've had a colonoscopy, I take that thing, and 30 minutes later, it's amazing.
Yeah, no, it's literally probably the greatest invention in anesthesia in its history. But ketamine
not for daily, nightly use.
No, so that's the problem, is that using propofol in your living room by someone who did not admit, so it's not the drug that's the problem, it's the person giving it or the person taking it.
My sense is more generally as it relates to drugs in our society, and I don't know if it's the far right or an attempt to use drugs as a tool to keep people of color down through incarceration and drug bill, whatever it might be, but we have a tendency to go very black and white. Marijuana helps people sleep, helps people with anxiety, helps kids with glaucoma, but we just decided, it was all bad. And it strikes me that no one wants to have a nuanced conversation around what is an appropriate use of a drug. And the fact that something like 85% of people who use alcohol and drugs are functioning, and it's not impacting them in a terribly negative way. Having said that, alcohol is a menace and terrible for tens of millions of homes in America. But nobody wants to have really what I would describe as a thoughtful conversation. They want to assign something is only used in a medical context, but when it's used outside of a medical context, it must be all negative and all bad. And we demonize it, criminalize it, and in my view, just make things, much, much worse. Anyways, it wasn't a question, it was a TED Talk.
Yeah.
No, you're right. The most commonly abused drug by far and away is alcohol. And, more people drown because they are drunk and doing stupid things in boats than have ever been drowned by ketamine. It was not even close.
Right. But this creates a situation where they're trying to bring ketamine and other psychedelics into really good medical uses, and then it gets either glamorized and demonized, both glamorized and demonized by people like Musk and others. Which is before it's a cart before the horse, because I think they will be using these. It's an intriguing drug, correct? Scott,
yes.
What's the responsibility of a board member in this situation? It looks like several board members talked to her. Someone's worried. This is why I can't imagine the Journal would move forward this, Rupert Murdoch and the Murdoch family would move without some level of assurance that they, and I have to tell you, discovery would be fascinating, because I don't think, the stories of Elon's wild party life are really quite out there all the time, and they just are.
The governance question here is complicated, because supposedly there was a director who resigned over concerns of Musk.
Because they weren't doing anything about it.
But I would argue he doesn't, and this goes to a broader issue here, I would argue that he doesn't have any governance, that it's family members and people who have made so much money because of his genius and his bold innovations that effectively they have no power. They're there to have dinner once every 3 months and collect a big check, because his behavior would not be tolerated across anything resembling what you would call a real board of governors who are supposed to represent fiduciaries. They just wouldn't allow it. So he doesn't have the duties, the duty and care that is levied on fiduciaries in the form of boards of directors does not and has not applied to Elon Musk for a long, long time. The fact that he's still on Twitter, that would never be allowed of a CEO who had done what he has done. A CEO incorrectly accuses former employees of being pedophiles, would never be allowed to be a CEO. He plays by a different set of standards, and whether you think he should be allowed to or not, but it goes to a much broader issue, and I think the key issue here, and what I would describe as the learning or the takeaway for young people, and that is the most important thing you can have in your life is people who love you and serve as guardrails. And to have people idolize you is different than having people who love you. And I think the guy has a lot of the former and not a lot of the latter. And as someone who has participated in interventions, they don't invite powerful, important people to those interventions. They invite people who love you. And this is turning into a cautionary tale along the lines of Tony Hsieh, because you have a guy who, as far as I can tell, is living alone, doesn't have a close relationship with a romantic partner or his children, and is, quite frankly, just fucking off the rails. And if at the age of 52, you don't have people in your life who can sit you down and you listen to, because you know that it's not that they got rich because of you. It's not because they think you're just so fucking awesome and can land rockets on 2 surfboards. It's because they just full stop care about you. If you don't have that, especially men, you literally can lose it all.
What happens with extended use of ketamine? If you use it a lot and there's no guardrails, as Scott says there should be, and I agree, what happens over time to your mental state? Or do we not know this? I guess we probably do, right?
Well, yeah. I mean, there's some research on chronic long-term use of ketamine effects on the liver and on the kidney. I mean, there are physiologic effects of it, which large scale use of it can be toxic to your liver and kidney. More importantly, I think though,
then what happens then?
Well, you could get, anything can damage your liver. I mean, there's so many, well, alcohol, number one, is the biggest. Yeah. But so the big problem, I think, with ketamine is the psychological, as Scott mentioned before, the psychological dependence on it. And it is a dissociative anesthetic. So you're not going to behave normally if you're doing high doses of ketamine. It just will make you not functional as a, human being. You'll be, high.
And then, Scott, Elon also has a lot of government contracts, which was mentioned in the Journal article. As CEO and founder of SpaceX, and he's also the key man there, Musk has a security clearance that gives him access to classified information. I think the Journal was trying to pin here's why we're writing this thing. And obviously the government has already objected when he was doing the weed on Rogan. This is a quantum level of problem, I would think.
Yeah, but again, he's an exceptional person that people and organizations make exceptions for. So, for example, he can put a breakthrough heavy rocket, he can launch it, and it can blow up, and he just puts another one up in a few weeks. NASA could never do that. NASA could never send projectiles into space to blow up. He is willing to take risks and has access to capital such that he can put together communications, low-orbit communications networks that the government, at least in this current infrastructure or current regulatory environment, isn't able to do. So he plays a really valuable role. And I don't want to be an apologist for the guy, but to think that he's going to be subject to anything resembling the same standards as other contractors, you might find it unfair, and it is. There are so many things he would have lost all security clearances for that the government has made exceptions around. He just plays by a different set of rules, I'm not saying that's right or wrong, but you could never see the head of the Forestry Service or the CIA going on podcast smoking a joint. That person wouldn't be allowed in a government building again.
I think it'll be interesting to see how he reacts. So, last question for each of you, Scott. How do you think Musk is going to react? I haven't seen anything yet.
I have no ability to predict his actions, Kara. I just don't. I don't understand.
He'll threaten to sue them.
Yeah, but I don't.
That's his go-to.
And I think all his fans will come to his defense and say that he's being persecuted and it's bad reporting. But I don't. Actually, when I read that, I felt bad because I have had some people in my life who have an addiction, and I find they slowly but surely, when you know you've lost them, is when they choose. I remember one of the interventions I was in, one of the most rattling moments I've ever had. Everyone went around. Kid was addicted to heroin. Everyone around said their piece, said, "I love you all. Your heart's in the right place. I know this is going to kill me. I choose heroin." I mean, no one knew what to say. So if he in fact is, I think he plays an important role. I don't like the man. I think he abuses his power. But as it relates to the government innovation, he does play an important role. And you just got to hope a guy with 11 or 12 kids like that gets help. And you also hope that the right way to react is if, in fact, he is struggling, that he's open about his struggles and people can learn from it. Because I do think a lot of people are fighting these demons in quiet. And a guy like that, who is literally the idol of billions of people, optimistically, you'd like to think he could play a key role in education about it. What he's actually going to do, I have no idea. You know him better than I do, Kara.
I think his tweets have become. I think this article means a lot of people close to him are worried again, as they were last Christmas time, and when there's a little downtime. And I think that's what it looked like to me when I was like, oh, I know who said that. You know what I mean? Like I could guess. So I think a lot of people are worried, and they're worried for a bad outcome in lots of ways, not just economically. And maybe this was their way of talking to him. His tweets recently have been pretty unhinged or juvenile recently. They've not been, I'm spending some time thinking or anything like that. And so, Jeff, that's my last question. If you were, I know some of his doctors, if you were his doctor, what would you say to him if he were to listen?
Well, I would say that, any kind of polysubstance abuse is not necessarily in your best health interests. And, clearly you don't go around doing fairly powerful psychoactive medications and drive a car or fly a plane or buy multi-billion-dollar social media companies. And I think that that's what I would tell him. It's just like, like the old adage, everything in moderation. I mean, one thing I just want to be clear that your listeners understand that ketamine is not a dangerous drug in the right hands. But like any drug, it can be misused, and it's a very useful drug. And I would hate to see a drug like ketamine, which is so useful, being demonized, and there'll be government reaction against it, et cetera, et cetera. That would be the worst possible thing that could happen, because it is a very useful medication. But I would just tell him, it's the same thing that would, if somebody came in and they were showing signs of alcoholism, I would say, this is really bad for you. And this is why. You just give him information. He clearly is a very smart man, and you try to appeal to people's reason.